Are you feeling trapped by the limitations of traditional diabetes advice? Stop the struggle and discover a new path to reversing type 2 diabetes.
Thank you.
Thank you.
Thank you.
Learn how to defy the guidelines and reverse diabetes with a simpler approach. Insulin resistance can be understood as a preliminary stage of type 2 diabetes. Insulin's primary function is to facilitate the movement of glucose or blood sugar into cells for utilization. In cases of insulin resistance, the process of transporting blood sugar into cells becomes challenging, leading to elevated levels of blood sugar after meals. In response to insulin resistance, the body compensates by producing more insulin. This compensatory mechanism may work for some time, maintaining normal blood sugar levels. However, it is not a sustainable solution, and eventually, blood sugar levels start to increase, marking the onset of diabetes. It is noteworthy that a significant proportion of the population, nearly 50% of adult Americans, grapple with diabetes or prediabetes.
No way.
No way.
No way.
This prevalence extends beyond those clinically diagnosed, as insulin-related issues can persist for years or even decades before formal diagnoses are made. Surprisingly, 16 to 25% of adults with a normal weight also experience insulin resistance.
No.
No!
No.
Consideration should be given to carbohydrates. They aren't essential. There is no need for them. The minimum daily requirement for carbohydrates is 0. Unlike essential amino acids and fatty acids, there is no essential need for carbs. The body can produce glucose continuously through gluconeogenesis. Despite this, recommendations persist for individuals to derive almost half of their total daily energy intake from carbohydrates without clear logic. This reduction in carbs lead to lower glucose levels, subsequently reducing the need for insulin. Research based on National Health and Nutrition Examination Survey and Haynes data identifies insulin resistance as the primary risk factor for coronary artery disease, contributing to 42% of heart attacks. The efficacy of a low-carb intervention is such that individuals can be rapidly weaned off substantial amounts of insulin within a short time frame. Please show your support by clicking the like button, subscribing to our channel, and sharing your thoughts in the comments section.
Let's go!
Let's go.
Insulin resistance raises the risk of type 2 diabetes and intensifies hunger and fat storage. Carbohydrates, proteins, and fats affect glucose and insulin levels differently. Carbs lead to a quick spike, proteins have a more positive impact, and fats cause minimal change. Consider real-life situations where overeating and subsequent hunger result from the rapid glucose and insulin surge caused by white rice, leading to fat storage and cravings. For those already insulin resistant, a cycle ensues. Consuming carbs elevates glucose and insulin, triggering hunger and fat storage. Recommendations for type 2 diabetes often include substantial carb intake, exacerbating the issue. Diabetes mirrors carbohydrate toxicity, causing short-term and long-term consequences. Insulin resistance signifies carbohydrate intolerance. The American Diabetes Association acknowledges inconclusive evidence for a specific carbohydrate limit but recognizes carb intake's primary role in blood sugar levels and medication needs. Coming up, we'll delve into crucial eating rules for managing insulin levels, including an intriguing mnemonic that could transform your approach to common dietary choices. For those who process insulin effectively, adopting a low-carb diet can still be beneficial, although it's not as critical as for those dealing with insulin resistance. Research consistently supports the effectiveness of low carb diets in managing conditions like diabetes, heart risk, and obesity. In a clinical study, 50 type 2 diabetic patients on a low carb, high fat program showed significant metabolic improvements and substantial savings on diabetes medications, over $2,000 per patient annually. The low carb group notably reduced insulin by almost 500 units a day compared to the ADA group, which increased it by nearly 350 units a day. This illustrates two diabetes treatment approaches, one aiming to reverse the disease and reduce medication, our approach, and the other aligning with ADA guidelines, viewing diabetes as a progressively medicated condition. However, the widespread adoption of low carb practices faces resistance due to the established status quo and financial interests in maintaining sickness. Specialty guideline panels often have conflicts of interest, hindering the promotion of low carb as the norm. Can individuals be completely cured like a miracle from diabetes? Not exactly. Let's avoid elaborate discussions and comparisons to TV doctors like Dr. Oz. When we say someone is cured, it means the problem won't come back. However, with diabetes, if one returns to consuming excessive carbs, the issue could resurface. So, it's not a cure, but diabetes is no longer present. It's resolved and can remain that way by avoiding the factors that cause it. Consuming fewer carbs doesn't mean consuming zero carbs, and it's not about consuming excessive protein. Some criticize this dietary approach, but those ideas are not accurate. Remember, there are only three main types of food:
What type is that?
Oh, what type is that?
carbs, protein, and fat.
Wow. Amazing.
If one decreases, one must increase. People following this approach consume a significant amount of fat. However, consuming fat can lead to satisfaction because it tastes good. The following are simple rules for eating, particularly crucial for individuals facing challenges with insulin levels. Rule number 1 emphasizes avoiding products labeled as light, low fat, or fat free in the grocery store. Despite fat removal, such items often contain added carbs and chemicals. Rule number 2 advocates for consuming real food, emphasizing the importance of recognizing natural, non processed options. Eating only what one likes and adhering to hunger cues rather than the clock is essential. The third rule is a mnemonic device: no GPS, meaning abstaining from grains, potatoes, and sugar. Notably, grains can exacerbate insulin issues, especially for the significant portion of the population facing such challenges. Insulin resistance precedes type 2 diabetes, affecting nearly half of American adults. Despite resistance to change, practical dietary advice emphasizing real and natural foods is crucial for managing insulin issues. Shifting the approach towards promoting healthier choices is essential in challenging prevailing norms around diabetes management. If you found this video useful, kindly show your support by giving it a thumbs up, sharing your thoughts or questions in the comment section, and subscribing for more helpful content in the future. Wishing you the best on your path to diabetes recovery.